So why?
There's a lot to understand with the health savings account, but I'm going to try to give you a few quick ideas to take away. First of all, by definition, okay, it is a tax-favored account, meaning you put money in tax-free, it accumulates tax-free, and you spend it tax-free on healthcare services, okay, when it's married with a qualified high-deductible insurance plan. This program was given to us out of the largesse of the United States Senate during the Medicare Modernization Act of 2003. Okay, there was a couple lines in there that gave us what was ostensibly the most significant reform in this industry, free market reform, since Medicare. Now let me go back a second and just give you a tiny bit of history, okay? The first HMO in this country popped up in about 1900, all right? 1929 saw the creation of Blue Cross, Baylor University, a very significant event, and I'm going to touch on it at the end. Then we saw World War II. What did that give us? It gave us wage and price controls, which meant now that insurance, employee benefits, were going to be derived through your employer, since they couldn't give wage increases. That's how we got this employer-based system. Then we saw Medicare, very significant, and in the 90s, 80s, and 90s, we went through the managed care environment, more HMO and PPO. Those are the evolutionary rungs on our ladder of healthcare finance and delivery in this country. The HSA is the most significant development, really, since what we had in 1929, and we're unwinding that, and this is an important concept. Unfortunately, as the doctor got to a little bit ago, there are forces that are separating us from our practitioners, from our doctors, the third-party payer. I'm here to tell you that a baby doesn't cost a $10 copay to deliver in the hospital. If you have a car accident, it's not a $20 copay in the emergency room. It costs a lot more than that. We didn't see rampant healthcare inflation in the 1910s, 20s, and 30s, and even the 40s, okay, until all of a sudden the information that is conveyed in price was shielded from us. We don't know what things truly cost. The health savings account allows you to accumulate money. You use it or keep it, roll it over from year to year to year, and now you're able to negotiate with your doctor, you're able to get information about price, and there's a lot more we could say on that, and you're allowed to be more engaged. I want to give you one example, okay? Many of you are wearing eyeglasses in here. Have you ever thought about laser eye surgery? You probably have. Laser eye surgery is not covered by insurance. But yet, what have we seen over the last decade and a half? There's a laser eye surgeon on every corner. There's one in the mall down the street. It doesn't cost $8,000 an eye anymore. It now costs $800 an eye. They take Visa and MasterCard. So we've seen access go up, we've seen innovation in technology, and we've seen cost come down. Why? Because the consumer is involved. Since HSAs were created, there are now 8 million Americans, 8 million people that are on the health savings account. These are people that are primarily age 40 and above. 2 million of them never had insurance before. This is the only thing that we've seen in the last 2 decades that is working. There's empirical evidence that it is absolutely working, and frankly, I'm ashamed of our elected representatives on both sides of the aisle for not trumpeting the value in the consumer-driven health model.
Right, that's a fantastic answer. I think that's something here in this room, and all of you can certainly help perpetuate to our congressmen and senators that the free market works when it's allowable.
Joe, it's not just, by the way, laser eye surgery. Okay, facelifts, cosmetic surgery. There's been innovation in that area. We have more surgeons in that area, yet the prices have remained relatively static. We see the drug industry. 10 years ago, they spent $55 million on those drug commercials. Today, it's almost $2.5 to $3 billion. That's the consumer engine working against us, really. I mean, it's not the doctor's fault that the patient comes in armed for the TV commercials and says, "What do you think, doc?" And the doc says, "Well, you only have a $20 copay, let's do it." That's promulgated through the system. We need to take that out so our doctor and our patient relationship is restored, and we can get to really what the true need is. I can see the doctor.
Just want to echo what Ryan are all the situations where insurance will not pay. That's called cash business, like the old days. And that's what brings down cost. What happens with your PPO now is that that's all marketed out there. And believe me, the physician isn't the guy making the money. The insurance company really collects a big bulk of that. And so costs go up and up. There's no incentive, really. So the key, again, those examples that he gave are only like faceless or whatever, they're all cash. And that's the way we need to restore healthcare back to. Reform needs to be going that direction. Not that all the costs obviously be cash, but more if it's in your hands as to how that is spent. You guide it, you direct it, you deliver it, you decide, I want the money spent for this or not. That's how we can get costs to come down.